Hello guys, imagine people slowly losing their vision without knowing the cause. This is exactly why glaucoma is called the silent theft of sight. It's called the silent theft of sight because it's not painful, it does not give any announcement, and it does not show any sign nor symptoms until it reaches a stage where your vision start going gradually and you totally have vision loss. Now the one bad thing about glaucoma is that with glaucoma, blindness is irreversible, meaning that when you are blind with glaucoma, you are blind for life. That is why you don't need to be panicked. On today's video, we are going to discuss some of the risk factors that expose people to have glaucoma. So stay tuned with me in this video. Don't go anywhere. Now, what does this glaucoma does? What glaucoma does for you to lose your vision is that our eyes are connected to our brain through the optic nerve. When this optic nerve is being damaged, visual information are not being sent to the brain. Now, talking about the risk factors, there are a lot of risk factors. Why is it that there are a lot of risk factors? Because the exact cause of glaucoma is unknown. Only related factors, which are the risk factors that we are going to discuss in this video. Now, the very first risk factors is high intraocular pressure. When the pressure of the eye is above normal, know that you are going to develop this glaucoma. Right? Developing this glaucoma, the signs will be there if you only go for an eye checkup. Now, another risk factor is age. Those of you that you are out there and you are 40 years of age and you have never gone for an eye checkup, this is a warning for you. Start thinking. We already made mention that glaucoma is a silent theft of sight, meaning that it does not show any sign, no pain, anything for you to notice that you have glaucoma. And so if you are 40 years of age and above, it is time for you to go for an eye checkup because you might have glaucoma without you knowing. Another risk factor is what? Family history of glaucoma. In a family whereby blindness is common and they are unaware that it's glaucoma that is causing the blindness because they have never gone for an eye checkup. Now, if you know you are in a family whereby blindness is common, this message should serve as warning for you to go for an eye checkup because it might be glaucoma causing this blindness in your family. Another risk factor is when you are having diabetes. If you are having diabetes that you have not been following up your treatment, it should serve as the warning for you. Go for an eye checkup because those with diabetes can have glaucoma. They can develop glaucoma. Alright? Developing glaucoma is a warning sign that blindness is on the way coming. If you are also having hypertension, this message should serve as a warning for you. Follow up your treatment, go for rendezvous, go for an eye checkup because hypertension can also cause glaucoma. Now, another one is long use of steroid eye medication. Those of you that you are fond of feeling a bit of pain, you rush into the pharmacy and they will give you eye drops without even knowing the right prescription. They will just carry steroid and give you, and you keep using thinking that you are doing yourself good. You are harming yourself. You are indirectly calling glaucoma to come. You are indirectly calling irreversible blindness to come. Stop going to roadside medication for eye treatment. Go for an eye examination in the hospital where proper treatment will be given to that particular eye condition. Also, those that are short-sighted, myopic people, if you are seeing only images that are closer, know that you are that kind of person that you are also prone to have glaucoma. So if you are a myopic patient and you have been forcing to see things that you cannot carry, it is time for you to go to the hospital for an eye checkup. Going to an eye checkup, they will be able to identify the situation to know if you are okay or not. And they will also give you proper treatment to maintain your sight so that you'll be able to balance the way you see. Now, general advice to those that are already on treatment If you are a glaucoma patient, that you know that you are a glaucoma patient and you have not been taking your treatment properly, it is high time for you to go and continue your treatment. Continue your treatment. With glaucoma, treatment is lifetime. You don't need to take treatment today, tomorrow you don't take treatment. Treatment is lifetime treatment. All right, continuous follow-up. Why do they give you rendezvous for glaucoma treatment? They give you rendezvous because they need to tackle that risk, that powerful risk factor, which is intraocular pressure of the eye. With that pressure, it can damage the optic nerve for a second. So that is why they give you rendezvous, and that your treatment should never get finished. The rendezvous is to control this high intraocular pressure and your treatment, because you can be coming or going for an eye checkup, and then the pressure keep rising, they will keep changing this medication, and no the one that will properly bring down the pressure. There are other surgical treatment too that they can do to bring down this pressure. So in the process of controlling, you need to take it seriously, because at the end of the day, you will be blind if you don't handle this situation properly. So if you're a glaucoma patient, be persistent in your follow-up, be persistent in your treatment. Don't sit back at home and wait till your medication finish before you go to the hospital. Respect all the rendezvous. Or if you are having glaucoma, you're having diabetes and hypertension, go for an eye checkup. Go for your follow-up, rather. Go for your follow-up. Follow-up is very, very important. Coming across this video, don't keep it to yourself. Share it to those that are around you, because glaucoma gives no signal, it gives no sign, it gives no symptoms. You might just got up one morning and you are blind. The blindness just come like that, and people will say it's witchcraft. It's not witchcraft. That is how glaucoma comes. All right, so don't forget to like this video, comment and share. We are in this together. I'm ready to give eye help to the world. Let's make the world brighter with